Hi there, nice to have you with us on this Wednesday when we discuss, as usual on the Wednesday, medical matters. Our resident GP is Dr. Vicky Skitter, and today we're looking at something it's fairly prevalent, isn't it? Thyroid problems.
Yeah, it is.
Okay, what is the thyroid? I know it's a little thingamagwadgy. Is it in your throat?
Yeah, it's almost there.
Thingamagwadgy
Thingamagwadgy in your throat.
Yeah.
So,
But what is it, and what does it actually do?
okay, so your thyroid.
Okay. Now she's ready to talk.
Your-
She said, okay.
Your thyroid is a butterfly-shaped gland that sits under your Adam's apple, along your thyroid, along your trachea. So it sits here.
But if you're a woman, you don't have an Adam's apple, so where
Yeah,
does
but just pretend I've got an Adam's apple. I've got a little one. So the thyroid, normally you wouldn't see or feel it if the thyroid's healthy. And the thyroid obviously produces thyroid hormones, and those hormones has everything to do with your metabolism. It's got to do with growth and development, muscle function, heart muscle function, pulse rate, blood pressure, temperature regulation. In childhood, plays a critical role in the brain development, and gut function as well, actually. So brain function, gut function. It's got a host of things that it has to do.
But now, what I don't understand is, I remember an aunt of mine, and I'm going back years and years. I'm probably going back to, before you even born,
That's
in the 80s.
not so long. Okay.
But I had an aunt who had a thyroid condition, and she had this huge, like a growth, it almost looked like. Yeah.
That's called goiter.
Yeah. Is that the same as thyroid?
So that was the thyroid, probably.
Yeah.
And that's goiter, which is a generalized sort of meaning for swelling.
Yeah.
And that can be due to mostly, thyroid problems often comes with autoimmune diseases, but that could be a lack of iodine, or it could be an autoimmune disease like Hashimoto's, one of those. But there are there's few things that can go wrong with the thyroid.
Okay.
Yeah.
What types of thyroid problems can occur?
You've got, I'm trying not to say so, you've got your goiter that we spoke about. Then you've got thyroiditis, which is inflammation. It's also a generalized term for inflammation of the thyroid that can be due to a viral inflammation or also autoimmune like Graves' disease. Then you've got hypothyroidism, which is an underactive thyroid. You've got hyperthyroidism, which is an overactive thyroid. And both of these can be caused, once again, by autoimmune disease. It can be an inflamed thyroid that's overactive, or some of the thyroid cells can be killed by the autoimmune disease. Then you've got thyroid cancer. It's uncommon, but the nice thing about that is it's usually treatable with surgery, radiation, and hormone treatment. So you can take the whole thyroid out if you needed to. And then you've got thyroid nodules. Those nodules, maybe your aunt had a nodule, I'm not sure. They can be bigger or smaller. Sometimes they're asymptomatic. But if they do produce an excess of thyroid hormone, they can cause thyroiditis or hyperthyroidism.
Now, you say you can take the thyroid out, but then it's not producing what it's supposed to produce.
No. No, it's not producing what it's supposed
Yeah,
to.
okay. But then, does that bring on other problems, or after a certain age, is it safe to take a thyroid out?
No. So your thyroid has to work through your whole life.
Okay.
If you develop thyroid disease, say you develop inflammation or a disease or autoimmune that makes it overactive, like hyperthyroidism, now you have to treat this. So you'll either go on medication to suppress the production of thyroid hormones, or they can give you radioiodine radiotherapy, basically, that destroys some of the cells, sometimes all of it, to treat the overactive thyroid, or you can do surgery. You can take the thyroid out. But often, after those treatments, you often become underactive. Obviously, if you kill too many cells of the thyroid, it's going to become underactive. Then you're sitting with a whole host of other problems. So, and that one has to treat again. So you sometimes start with becoming overactive, and then the thyroid sort of burns out or gets treated, and then it becomes underactive. So it's quite a complicated thing. It can be.
A little butterfly in your throat can be a damn complicated thing. So then what kind of tests can be done on your thyroid to determine where it is, what it's doing?
You can start with blood tests. That's very common. All the GPs do that. We do it every day. So you start with something called TSH, which is your thyroid stimulating hormone. That gets produced in your brain, and that basically tells your thyroid to produce hormones. Okay, so that's at the top of the triangle type thing.
Okay.
If you've got an elevated TSH, it means your thyroid is probably underactive and your brain's telling it to make more. Hey, where's my hormones? Make more. And if your TSH is high, it means you've probably got an underactive thyroid. No, I've said that twice now. So if your TSH is low, you've got an overactive thyroid. Yeah, so it's the other way around. So that's the TSH. Then you've got the primary thyroid hormones, T3 and T4. That's also just a blood test. Then you've got the thyroid antibodies. Now those antibodies, they go up and they suppress a certain enzyme that the thyroid needs to make hormones. And when those antibodies are up, it often shows a bit of inflammation or autoimmune disease. And they cause problems for your thyroid. So you can check for them as well. And then the last thing blood test-wise is thyroglobulins. Now, thyroglobulins is sort of a cancer marker for thyroid cancer. You wouldn't diagnose thyroid cancer with thyroglobulins, but you will do cancer follow-ups with it. So if it's high after you say taken out the thyroid, then you might have a problem. The thyroid, the cancers come back or something like that. But you can also do a sonar to see if it's cystic or solid lesions. You can do different kinds of scans. You can do CT scan, MRI scan, PET scans, and then a thyroid biopsy can also be done, where you take a little piece of it. So there's lots of ways to diagnose what's wrong with your thyroid.
Okay, now somebody's sitting watching this podcast and they're going, oh, I think I may have a thyroid problem. What are the symptoms of a thyroid problem?
Okay, so you get overactive thyroid and underactive. Yeah.
You see, I'm learning, eh?
Yeah, very good. Overactive thyroid, you'll be all hyped. So you'll have palpitations, you'll be anxious, you can get tremors and shaking, you can get anxiety, irritability, you can be very sensitive to heat, so you get you get hot easily. You can get insomnia, sleeplessness, tiredness, weakness, and weight loss. That's quite common. So that's normally the overactive. The underactive is sort of not almost the opposite, but almost the opposite. So you get brain fog, you can get depression, also tiredness and weakness. You can get weight gain, you can get loss of libido, you can get abnormal periods, irregular periods, or very heavy periods. Also common is dry skin, brittle hair, brittle nails.
So there are a lot of things to look out for before you go to your GP and say, look, I think I may have a thyroid problem.
Yes.
Can you treat it?
You can treat it. So the basic treatment for underactive thyroid, we've already spoken about the overactive, where you can do surgery and you can take drugs and you can do radiotherapy. So the underactive thyroid, you're going to give a synthetic thyroid hormone, basically. And that should reverse those symptoms. It should make you feel better. It should even lower your cholesterol if your cholesterol was up due to the underactive thyroid. And you should feel and look better. But it's a lifelong treatment. You can't just take it and then your thyroid's fine and then you stop it.
Carry on.
It's a lifelong treatment, and also you need to check thyroid hormone levels on those patients regularly because it can change. You know, as your body changes, as your anxiety levels or illnesses changes, you need to check your thyroid again, say every 6 months, because sometimes we need to adjust that dose.
Okay.
And it's also important, one thing, that if you are on thyroid medication, it's very important to take your tablet first thing in the morning on an empty stomach. And an hour after, you don't take anything. Otherwise, it doesn't work properly.
Dr. Vicky, thank you very much.
Pleasure, Jeremy.
Yes, I tell you, I learned so much on this show.
Me too.
Dr. Vicky Skitter, our resident GP, who will be back with us next Wednesday, right here on Mansfield Today. Until then, cheers and look after yourself.